Rehabilitation is a complex dental treatment that you use if a lot of things have gone wrong. The reasons can be multifold, so there can be a lot of broken teeth, a lot of infected teeth, for example. It can also be that the teeth are very worn for different reasons, or that a lot of teeth are missing. And with this rehabilitation, we try to solve these problems and aesthetically and medically achieve a better and stable treatment result. The kind of treatments that you perform, of course, also depend on the individual case. So in the beginning, we have to find out what the reasons for the problems are, treat these reasons, and then it can involve a lot of different options. It can be necessary to move the teeth, so an orthodontic treatment. It can be necessary to replace teeth with implants or dental bridges, maybe stabilize teeth with dental crowns, the root canal treatments. It's a lot of different aspects of dentistry that go into such a treatment. If you have a lot of problems, and oftentimes patients are really frustrated with the situation that they have, then of course it's an understandable idea, if you had so many problems with your teeth, just to take them all out and replace them with something artificial and something else. However, that's not really, in our opinion, the best solution in the long term. Because you always think, somewhere else the grass is greener, everything is easier and better, but there can also be problems with these solutions. And usually you can treat teeth quite well and maintain them also very well over a long period of time. And that's why we try, of course, only if it's possible, but if it is possible and we see a path, then we try to keep as many natural teeth of the patient as possible and use this as a foundation for the entire treatment. So a dental rehabilitation usually is done in 3 individual steps. In the beginning, we have the big goal to make everything healthy. So this is usually one long appointment at our office. And on this appointment, we remove teeth that might be broken. We treat all the caries, we treat all the infected roots, for example. If necessary, we are also able to place the implants on the same appointment, and the patient leaves the office with really stable and very good looking long-term provisional restorations that we produce with the computer. So after this long first appointment that is usually done in a single day, the patient has a healthy situation and a big improvement towards the beginning. Afterwards, we have a treatment phase in which we wait a long time, usually 6 months, to make sure that we can really test drive the teeth and also the aesthetics, that everything's okay. And if necessary, we also do additional treatments like moving teeth or placing implants in sites where it wasn't possible before. And once everything is okay, we go into the final phase, and that's in general 2 appointments. On the first one, we do scans, 3D scans of the face, of the teeth, of the provisionals of the patient. We do videos and photos, send everything to the laboratory. They produce the final restorations, and then we can place them around 2 weeks later. My name is Sebastian Horvath. I'm a dentist and certified qualified specialist for prosthodontics. I love being a dentist because it's a great combination of doing something medically, which has a big impact on our patients, and also doing something with your hands. I also give courses for other dentists, and I wanted to create a slide in which I, try to tell them that when you do something new, you should focus on stuff that really brings you forward like a rocket. And, I created this slide and I loved it so much that today our office is full of rockets.